Here in Nigeria, the federal government has confirmed 7,202 cases of diphtheria out of the 11,587 suspected cases across 105 local government areas in 18 states, including the Federal Capital Territory. The federal government in a statement said most of the confirmed cases were recorded in Kano, which tops the table with 6,185 cases. Now, other states with cases are Yobe, Katsina, Borno, Kaduna, Jigawa, Bauchi, Lagos, FCT, Gombe, Osun, Sokoto, Niger, Cross River, Enugu, Imo, Nasarawa, and Zamfara states. Now, Diphtheria Incident Manager, Federal Ministry of Health, Dr. Augustine Ajogwu, joins us now to discuss rising incidents of the outbreak and efforts being made by Nigeria and its partners to combat this incident. Good to have you here on Newsday.
Thank you for having me.
All right, Dr. Ajogwu, let's get it started. This is not the first incident of diphtheria in Nigeria. It actually came in some months back, almost a year now, and it actually dissipated. And we are seeing rising cases again. What is responsible for this latest outbreak?
Okay, first of all, I want to correct one impression. I'm an incident manager for FCT diphtheria rapid response. I'm not incident manager for Federal Ministry of Health. Like your question, I see a lot of diphtheria cases was received earlier this year in January, and from those states you mentioned, Kano and Yobe State and Lagos State. And FCT being dynamic, people can move into FCT in and out. There has been a rapid response team that has been in place to ensure that no case of diphtheria is left detected in FCT. And when we detected our first case in June, we quickly activated our incident management system involving multi stakeholders to contain the outbreak. And you know, it's a vaccine preventable disease, and it's case-based kind of surveillance. And we've been picking them up, and they've been receiving adequate treatment as far as FCT is concerned.
Well, thank you so much for clearing that up. Well, we understand that, you know, the government has said that it has been coordinating surveillance and response activities across the country since the outbreak back in December of 2022. Now, seeing that this surveillance response activities definitely started or likely started preceding this administration, would you say that the preceding administration laid the proper foundation for this administration to build on, or is the Tinubu administration working from scratch in order to come up with, you know, response activities in order to tackle this health issue?
Yeah, actually, there has been a good foundation right from the community level, because throughout the country, because all the communities have a surveillance focal person to the ward level, to the local government, and to the state. And what the current administration did was just to latch on this strength. And just last month, the current Minister of Health constituted an interagency task force involving the NED of National Primary Healthcare Development Agency, and also the DG ED and the DG of NCDC to oversee and chair this task force. And they have been mandated to ensure that they contain these diseases in all the states that are having this outbreak. And they have kickstarted the action, and the response team have been formed, and they have been dispatched to all the states to help in containing the response, the outbreak.
All right, you're speaking about containing the outbreak. Well, let's actually dial it back a little bit and talk about how does diphtheria spread amongst the people, and what are the possible signs to look out for to be able to identify someone that's got diphtheria?
Yes, it's a bacterial disease, a bacterial infection that spreads from person to person, and also among health workers. and it could be spread by in a crowded environment, and also by coughing and sneezing in a crowded environment. So it's from person to person, and also health workers that are treating these cases. And thankfully, it's a vaccine preventable disease. And why I would think that this infection is coming up is because of low coverage of immunization nationally. But immunization, there has been a immunization plus days and SIAs to cover up this low coverage, and children are being immunized to ensure that to reduce the infection nationally.
Well, we certainly hear you. Thank you for clearing that up. But Dr. Austin, I'd also like to go in the direction of the reports that suggest that the historical gap in vaccination coverage is a huge driver of the outbreak, given the most affected age group and results of the nationwide diphtheria immunity survey that shows that 42% of children under 15 are fully protected from diphtheria. That's a relatively significant percentage. But I'm wondering if you can clear up how this historical gap is also fueling what we're seeing today.
Yes, that's exactly what National Primary Health Care Board and also Primary Health Care Board in all the states are trying to fill this gap. And you know that this gap has also been affected by COVID-19, because COVID-19, during COVID-19, all these activities, essential activities, were on hold. They didn't go as supposed to go because of COVID-19 activities, COVID-19 pandemic then. But activities, essential services are picking up, and immunization is also picking up, in addition to immunization plus days and SIAs to cover up the gap that has been created by this COVID-19 pandemic.
All right, Dr. Ajogwu, permit me to still take you back to my second question, which probably maybe got missing in the whole discussion. Let's talk about controlling the spread of this disease. And I asked a question in the line of, how do we spot someone that has got diphtheria, and how do we control the spread of diphtheria?
Yes, if anybody that is coughing with a sore throat is one of the community case definition, fever and sore throat, that we need to go to the hospital early to check whether the person is having what we call, there's a pseudomembrane that covers the back of the throat. So any child or any adult that is having fever and coughing and having sore throat should go check him or herself up, so that we'll find out whether it's diphtheria or something else. So there is need for people to present early in the hospital to find out what it is.
Definitely. Now, when you look at the areas or the states that have been affected, where we've seen cases of diphtheria, is there any state that you're very concerned about based on the response of the stakeholders there, that you might not be too impressed by or might need to step things up?
Actually, there's no state that has not stepped up to contain this disease, and while most states, let me speak for FCT, I've been working with all the stakeholders, all the partners, WHO, and other development partners, and also the community leaders who helped us to find these cases and alert us, and will link them to care. And also who have also be helping us to do active case search in the community to find cases who might be staying at home or resorting to self-treatment. And because most of the time in our environment, people will want to try one means or the other, try local drugs, or also try to do self-medication. So these community leaders, surveillance focal persons in the communities and the world, helps us to find all these cases with doing active case search to link them to care.
All right, Dr. Ajogwu, there is a stat that says, the government says 73.6% of the confirmed cases occurred amongst children ages 1 to 14. You've mentioned, I know in your discussion, you've mentioned adults, but is this more prevalent amongst children than adults?
Yes, actually, it's more prevalent among children than adults. And like I said, apart from, in addition to low immunization coverage, we have also noticed that some parents don't like taking their children to the health centers for immunization. There is also an increased vaccine hesitancy, which we are working very well. And I think it should be part of this interview to educate our people. Let them take their children to health centers for these vaccines. They are free and they are available and they are safe.
Well, I think you've passed the right message. They are free, available, and safe. Dr. Ajogwu, thank you so much. Dr. Austin Ajogwu, thank you so much for your insight and the fight against diphtheria. We appreciate you joining us here on